Performing a hip flexion manual muscle testing on the patient. I will have the patient seated supine with their legs hanging off the table. An alternate position would be laying them on the side to minimize gravity effect on the hip. So for this test, I'm testing the hip flexors, which are the rectus femoris, the vastus intermedius, the vastus lateralis, and the vastus medius. I'm going to apply my stabilizing hand, which is on the iliac crest of the patient's hip and the ASIS, and I will put my testing hand on the lower third of the femur. I'm going to ask the patient to lift up their knee, and for the make it test, I'm going to apply my stabilizing and testing hands, and I'm going to apply some resistance as they repeat that motion. Okay, and can you please go back into that motion? And for the break it test, I'm going to have the patient keep this position as I apply resistance, and they will prevent me from breaking it. Very good. Performing a hip extension manual muscle testing. I will have my patient laying prone, so on her stomach. For this test, the muscles I will be testing are the hamstring muscles, so the bicep femoris, the semitendinosus, and the semimembranosus. For this test, you can have the patient in two different positions. You can have them in knee extension while performing hip extension, or knee flexion. My stabilizing hand will be on the iliac crest, and my testing hand will be on the lower third of the femur on the posterior side of the leg. So I will have my patient first perform hip extension. So yes, like that, very nice. And then now I will perform a make it test. So I will put my stabilizing and testing hand, and she will repeat that position as I apply some resistance. Okay, and now she's going to stay in this extension as I push down and try not to break the position. Very nice. I'll be performing a hip abduction manual muscle test. So I will have my patient laying on their side with their back towards me. She already did it, but I'll bend the lower knee so that she is more comfortable. There you go. Okay, for this test, I will be testing the gluteus muscles, the piriformis, and the sartorius muscle. For my testing hand, I will place it on the iliac crest of the hip, and my stabilizing hand on the iliac crest of the hip, and then my testing hand on the lower third of the femur on the lateral side. I'll have the patient raise her outer leg for me, please. Thank you. I place my stabilizing hand and my testing hand, and this will be the make it test, so I'll have the patient repeat that motion again as I apply some resistance. Very nice. And she's going to stay in abduction as I push down. Very nice. Relax. Okay, and an alternate position would have them seated supine and perform hip abduction. I won't perform it, but this is easier to do it on the sidelines of games. Yeah. Alright, I will be performing a hip adduction manual muscle test. So I will have my patient laying on her side with her back facing me, close to me. And for this test, I'm testing the adductor muscles, and the gracilis muscle. Yes. Okay. So for stabilizing, I will wrap my hand around the lower leg of her outermost leg, and I'd be testing her lower leg. So I place my testing hand on the lower third of her femur. I just ask for her to raise her lower leg for me. Thank you. I place my testing hand, and she will repeat that motion as I apply some resistance. Okay, and she's gonna go back into adduction as I apply some resistance downwards, and she will resist my pushing. Very nice. And an alternate position you could do on sideline of games is just having her sitting supine and performing a deduction as well. Great job!